Hello, very good afternoon to one and all. I am Shalini Fernandez, one of the OET aspirant who has passed from the EduSkills and reached the UK last 8 months back. I am privileged to be with you today. On the onset, I would like to appreciate and thank Father Saleen Joseph for giving me this wonderful opportunity. So, dear friends, the reason why we are here is very clear. At the onset, I would like to appreciate and thank Father Saleen Joseph. So, the reason why we are here is to talk about, to give a bird eye view of OSCE. When we talk about OSCE, everyone is scared. I was also the same position like you all today you feel about it. But friends, don't be afraid. I just want to say one thing. OSCE is nothing different. As nurses, we have attended a lot of exams which are more tougher than the OSCE, and we have cleared it. If you say about OSCE, it looks very difficult. It looks very stressful, but it is not. So be prepared. And if you have any questions, you can ask those questions in the chat box. And let me try, if possible, to clear your doubts. So to begin with, all of you, what is OSCE? You know, OSCE is an objective, structured, clinical examination. And OSCE has been done in India as well when we conduct the exams, especially during the Corona timing, where we had everything through OSCE because we were not able to go to the clinicals. So now your question will be, why do we need OSCE in the UK? I would say to register yourself and to practice your nursing in any countries, they have got their own exam to certify you that you are eligible and you're confident and competent to practice without anybody's supervision. That is why we have OSCE in the UK to register yourself in the NMC Council. NMC is Nursing and Midwifery Council in the UK. So that is the reason they organized this OSCE exam. Hope everybody is clear with this. Moving on to the next question, if I say, how long the OSCE exam will be conducted? You know, when we say about the exams, usually the exam lasts for 3 hours. And I can say OSCE is also the same, which will go up to 3 hours. Okay, and it is not that you just keep on writing or scribbling something. OSCE is a mixture of things where you have got different stations, which I'll be talking in detail as we move forward. So where does this OSCE will be conducted? Once you come to the UK, your trust, where you are entrusted to, they will organize or they will select the date and the center to write your OSCE exams. So it will be conducted in different places. For example, if I had to say my trust had arranged me the OSCE in the Oxford, and some of my colleagues had gone to Swindon, and some of my colleagues had gone to Northern Ireland, and some of them went to Leeds. It depends where your trust gives you the placement. Does not matter. Wherever you write the OSCE exam, the structure is same. Examiners' criteria will be same because it is a universal. It does not matter which center you write the exam. Now, everybody is worried. What is the payment that we have to do for OSCE? We are lucky enough in the UK, the payment is done by the center. We are really privileged because the first cost when you enter yourself for the OSCE, it is around £794. Can you imagine? It is almost, if I have to calculate in the Indian rupees, it comes around 80,000. Friends, it is a marvelous, marvelous contribution from our trust to us. But do not misuse this effort given by the trust. Because we have seen when we don't pay from our pocket, we don't take the things very serious. Believe me, take the things seriously so that you will benefit as well as the benefit goes to the trust. But in case you fail and you have to write, that time the fees will be 397. That means almost 40,000. Who will pay the amount when you write the re-exam? When you write the re-exam, there are some trust, they will pay it. In case if I talk about my trust, it is we who have to pay for the second attempt, that is 40,000 of Indian rupees. And believe me, I don't want to spend those amount, so I will not try to fail. I will try maximum so that I pass, and I have done it. Then, coming to the how many times you can write the exam. You can write the exam many times, that is 3 times. Okay? 3 times you can write the exam. But the date will be again scheduled by your trust. Because if you fail today and the result came and you cannot write the exam tomorrow, because there should be enough time to recall and admit what you have done mistake, and you go through it and write the exam again. So at least they will give you 10 to 15 days to sit for the second exam. In that also you fail. So you have got another chance, and that is a last golden chance, which you should not miss it. That is the third attempt. Once you fail in the third attempt, then your registration will be cancelled. You need to write again CBT, and again you have to re-register yourself into the NMC. Then you will be doing the test again. Definitely in this platform, I don't think so anybody reach to that stage. Definitely not, because in the 8 months of my experience in the UK, we have got different cohorts, the people who are coming from India and writing the exam. I don't hear anybody gone beyond second attempt. Nobody goes, because once we fail, we become more serious, definitely. So don't think about failure. Let us say that we are going to clear the exam for the first attempt. Coming to the next thing, is OSCE exam is difficult. Believe me, the most of the time what happens here is people listen from other people. For example, we are 10 people in the room, because during the initial stay in the UK, we are given accommodation by the hospital where 10 to 15 people are in one accommodation. And I go for the exam and I feel that I have not done good in the exam. It is not that OSCE exam was difficult. It is because I was not well prepared, and it is because the fear that I had facing the exam that made me to fail in one station. But what I say when the friends ask, oh my God, OSCE was so difficult. My God, you will not pass. I do so much things, but I fail. It's very difficult. It's very difficult. So you only take that difficulty in your brain, and the brain processes that difficulty. And whatever you do, you feel everything is difficult. What is my kind advice is, get from your friends, not the difficult things what they faced it. Ask them if you're really keen to know what is OSCE, how is the structure, what is the exam went about, what they asked, those things you ask. You don't ask them the personal experience that they faced, which will really demotivate you. Because I have a colleague who was very, very good, because we were practicing together, very bold, very nice. But what she did was, her practicing initial stages, she only listened to different people's experiences, and the people would say, my God, that examiner was so bad, the center is so hard, everything is negative, she fed in, and she went there. When the examiner say, your time starts now, she didn't know, she dropped her, dressing kit, where she had got the wound dressing, she dropped the tray down. With the fear, she picked it up, And because when you're scared, you do a lot of misses, or we say mistakes. But those things can be rectified. If she was not afraid, she would say, sorry, in the real exam, I will not, in the real practical scenario, I will not do this. The best thing in the UK, in the OSCE exam is, even if you make a mistake, and if you rectify that, saying that, in the real scenario, I will not do this. Sorry, it happened like this. Because rectification gives you a reward. But what happens mostly is we forget to rectify. We forget to rectify. That's why I say, don't get scared. Be courageous. Face the situation as it comes. Don't be worried. No worries. So I would say, as a OSCE past candidate, OSCE seems to be difficult, but consistent, continuous practice, as Father always says, make you pass the exam. So never take things lightly. Then I want to tell you at this point, why do people fail? Before I could go to the different stations, I will tell you why people fail in OSCE. There are various reasons why people fail. First and foremost, I would say that is lack of communication. We have written many exams in the first year, second year, third year, and fourth year exam, where we went to the exam center, paper and pen was given, whatever we biated, whatever we are grasped in the class, we are just put it in the paper, where we did not talk at all. We were very, initial maybe 5 minutes, we were scared when the paper bell rang. But later, we wrote it something. And as a teacher, I could say, people write nonsense in the paper because they know they need not communicate. And they know it's already written. Only the thing is, teachers will read their paper. And sometimes I feel we have good entertainment when we read the paper of the students. Sometimes we'll pity for the students, whatever it is. But the thing is, in the OSCE, we need to talk because we have patient, that is a player, that is called acting people. That the actor is there in front of you, examiner is there in front of you, and you are there with all the equipments. And now what you have to do is, you cannot blindly do your injection if the injection you got it. You need to talk to the person. You need to talk to the person, who is he, why did he come, how is he feeling, and what you're doing, and this is what I did it, thank you. All these things has to be communicated. That is why we clear English test before we do the OSCE. All are clear? That is why if you do not have good communication, there is a chances of failure. But do not worry. I think the students, the aspirants under Father Saleen's platform, that is our platform, EduSkills, none of them would face these failings because, because we have got ample opportunity to speak up in this platform, which no platform gives us this. So I don't think so any one of us will have this difficulty of lack of communication. But for your notice, I just bring out this point because I have seen people fail because they made a mistake, but they did not talk to the patient. She did everything perfectly all right, but she failed to ask the patient, are you allergic? If at all she would ask, are you allergic? He would have told, yes, I am allergic, and she would not have given the injection. Because she did not ask, she gave it, and the examiner say she administered allergy drug, which is a drastic mistake any nurse can do to kill the patient. So always remember, communication plays a vital role, not only in the exam. As my experience with the people in the UK, I can say communication is the key skill that every individual should possess. Because with the communication, you can win the hearts of the people in the UK. That is what I enjoy the best here. So communication. Second point why people fail. You know, as Indians, we are always in a hurry to finish our task. When you are given a skill, you are given a procedure, for example, you are given a dressing. for the person as a skill to demonstrate in front of the examiner. Before that, they will give the scenario saying that Mrs. Shalini, this many-year-old, she has got a wound on the left leg and it is tata like this. Now what happens? I assume I know everything. I don't read the instruction. Straight away I go, I lift the patient dress, I do something and come back. But examiner has got a checklist which says that Shalini will be introducing the patient herself. Shalini will be finding out whether the patient has allergy. Shalini will be finding out whether the patient has a pain. So those things I have not done it because I have not read the instruction clearly. So I finish my job with no criteria. There is a chance why we fail. Is it clear? I hope it is clear to you all. What is the third point that we fail? Very important. I was a staff nurse for 10 years. I am a professor in the college for 15 years. And I see the students when they go to the clinicals, they do everything perfectly all right with the patient, the things they're supposed to do it. For example, first year student gives wash for the patient. She beautifully cleans the patient. Patient is very happy. She went home. Now, what she did not do? She did not document that patient had a wash. What happened now? The second shift nurse came. She started to give bath. Patient says, I had already had a bath. Now the nurse is in confusion because she is not aware, because there is no written things in the patient chart. Neither the nurse has not told it. So we do duplication of work, which shows that patient also feels some insecurity with you because patient understands this nurse does not know what is happening to me. So how can the patient rely on you? This is just a wash. Think about it. You are taking the injection and going, which the nurse has already given it. And if the patient is not talking, patient is unconscious, you're giving double dose. That is why documentation plays a vital role. We take it very lightly because Indian situation when we work, things are not severe. Even if you're not done it, no people will go to the court and sue you. Now they have come up with the patient rights, but still you can convince. But in the UK, all patients are educated. You cannot take things granted and say this, no. So documentation. In the exam as well as anywhere you go, documentation always saves you. I always tell to my students, documentation is the safeguarding thing for you. Documentation speaks about you. Documentation supports you when something comes wrong. And believe me, when we work in the NHS, thousands of people will be taking care of single patient. Today I go, tomorrow somebody. And if you don't document it, patient, something happens to the patient and somebody has documented and you're not. So who is going to face the consequences? That is you. That is why documentation plays a vital role. So if at all in the exam as well, you get the injection, you do everything. Finally, you say to the patient, let me document what I have done to you and write it, injection given and your signature and time, you pass. You did everything and the examiner is very happy with you. Oh my God, this girl is wonderful. She didn't even skip any step in the injection procedure. And she goes down, the checklist, what she has in her hand, shows the last point is documentation and you're not done. And that is the important thing where you lose the marks and you fail. And you come and tell in the room, my God, I have done very nice, but why I fail? Because the good thing, you get the remarks from the examiner when you fail in the exam. They will say, you did not document it. Oh, then it is eye-opener to you. You say, oh my God, I should have done it. Yes, in the fear, in the stressful situation in the exam, everybody forgets. But I would say at this juncture, don't forget. Fix this in your brain. Fix in your mind. Whatever the thing, I will document it. I will document it. So you do it. When you're practicing, you practice documenting. Then only it will become a practice. A routine practice will remain forever. Is that clear? Fine. Now, next point, why the person fails. Failure to perform hand hygiene. Believe me, as a nursing professional for 22 years, I would say nurses, I don't know what to say, nurses fail to wash their hands. Even during the situation of Corona, they fail to wash hands. Believe me, washing hand is simple, I know, but it is really, really very, very important. Very, very important. If you don't practice it, even if you practice for 1 month here, you tend to forget it. So what is my advice today is, when you practice your nursing in India itself, you're practicing your nursing anywhere. It is not only India I talk about, because hand hygiene is mostly neglected with everyone. I don't know. It takes only less than 3 seconds, I feel, but still people fail to do it. So what I say is, you practice your hand hygiene when you're practicing your nursing in your places now. So let it become routine to you. So when you come here, even you're stressful, even you're afraid, you are scared, you will not forget, because it is in your blood. Hand hygiene is in your blood. So I ask you to do that. All right? Yes. Next, why do you fail? We fail to identify allergy. This is allergy is the one which I found it different when we deal in India, because I am talking about India because I am from India. I don't remember I asked any patient every time, are you allergic? Are you allergic? I don't remember. But I'll tell you, from the day one I entered to the clinical, every time when I go to the patient, even I'm going to put him the dressing, even I'm going to give him the injection, even I'm going to give a feed, I ask first thing, Mr. Simpson, are you allergic to food? Are you allergic to latex? Are you allergic to rubber? Are you allergic to amoxicillin? I ask, because these people are having lot of allergies, and allergies is, I can say, it is a pivotal thing that you have to remember to ask. So now when you're there itself, you try to ask. So you will know, are patients whether they're allergic to something. So that is something innovative thing that you can put it in practice now when you're in your countries now. So ask for allergy. That is not asked, we fail. So these are the points why people fail. I think I made it clear to everyone. So I would say poor communication, poor documentation, then poor hand hygiene, then failure to ask allergy, and I can say to look at the scenarios and the instructions. These are the 5 things mostly you fail when you don't do it properly. If you are very pucka with this, I don't think so any one of you will fail, because these things what we do in OSCE is nothing different than what you're done in first year. If at all you're done in first year and you passed first year exam, there is nothing to fail here. All right? So the only the practice, which makes the person perfect. Now coming to the next thing. If you have written the exam, okay, this how long this OSCE will be valid. Now, the OSCE is valid once you finish your CBT for 2 years, the OSCE is valid. Within the 2 years, you know that your CBT also expires, right? So you need to complete it, and that is not the problem for you. Who is eligible to write OSCE? Nurses and midwives who are trained outside the European Union, like India, Philippines, Japan, whichever countries, we are supposed to write the exam, clear our exam. Then only we get the PIN number. PIN number is nothing but it is a registration number, which will be you are proud of, because you can move with that PIN number wherever you want it, and it is very, very precious. Okay, now let us come to the real OSCE. How is the exam structure? I'll tell you, OSCE is a 10-station exam. What is this 10 station? The 10 station is nothing but you have got 4 stations. Those are called API station. API is nothing but it is the capital alphabets. A stands for assessment. P stands for planning. I stands for implementation. And E stands for evaluation. These are there for everyone. And it is standard. What is assessment? You will get a scenario. Scenario I need not explain to you. You get a scenario saying that Mr. James, 24 years old, admitted with the breathlessness, came to the casualty, Now, you do the A, B, C, D, E assessment and finish. Now, what happens? This station will be given for you. You get around 15 minutes to complete. So, what you're supposed to do here, once you are inside, you will be there with the examiner. Examiner has got a lot of checklist in her hand, computer in her hand, because she has to mark what you have done, what you have done wrong, because they have to give you the feedback. So it is a room, one room. You don't go to the hospital. It is a single room. One side they kept all the articles, what you require. There is a camera, not to record what you're doing, what not doing. Camera is required because that examination has to be assessed by others also. If at all tomorrow you say that I have done it and it is not done, they have to have an idea what was done. So the camera is there. Now, once you are ready, the patient comes in. Who is the patient? It is an examiner. It's the actor who is there in that institution who act like a patient. Now he'll come and sit. Once he come and sit in the chair, patient will not initiate any talk. This is you as a nurse will start because you have given a background of the patient. Now you should know as a nurse, you have to think this is an artificial setting, but you have to imagine this is the ward which the name they give. They give you, you are in a medical ward, you are in surgical ward, like that they give the scenario. Thinking that, keep it in mind, and now you start your conversation. You start with the conversation like, wishing, hi, good morning. I'm Shalini Fernandez, registered nurse. Who will be looking after you today? May I know your name, please? So you will say, because it is there, your name is there. You can call out the name. If the name is not given, now you need to ask the name, because later you cannot say patient, patient. No, you should say Mr. John, like this. So you have to get the name. Now you will proceed assessment, because A to E assessment. You will ask airway. You need not worry what to ask in airway, because when you practice your OSCE, your mentors in your trust, they will give you lot of checklists like this. You will get bundle of papers, which each procedure, they will tell you what to be studied. So they gave everything. So everything is ready-made, nothing to put from your brain. No, only you need to learn. Only you need to know what is important in that, and don't miss it. When you practice, keep the checklist that is called criteria in your hand, and you practice. If you miss one criteria, re-practice. See that you put that criteria in your practice. So that is the assessment. In the assessment, you have a actor, real patient. Okay, real patient in the sense, artificial ear, but you cannot say it is a mannequin. He is a person. If at all you get in your scenario, patient is breathless, he will breathe very fast. Like that, then you'll stop the breathing. You should be very smart because they act like a patient. So sometimes what the nurses do here is, with the fear, without checking the respiratory rate, simply they imagine and say, patient respiration is 12. You fail because he has a respiration 28, 30. Because patient knows, he's a nurse, isn't it? So he is counting. He knows. So you will fail. Sometimes what happens is, in the BP monitor, blood pressure monitor, they put the blood pressure 140 by 80. And what happens is, we have a tendency, anyhow, there is a blood pressure in the machine. So let me simply act BP checking and we'll tell this. No, wrong. The BP may be only 90 by 70 for this patient. So don't think what is there in the monitor, it is your answer. No, it is there. They have done it. Maybe to frank you, maybe to assess how sincere you are within yourself. So you do it because you have done blood pressure. How many patients in your life? Isn't it? So to do one blood pressure here is nothing big. You take it. Really, you take the blood pressure. Really, you take the pulse. There are people who are taking pulse only half minute and multiplying. Don't do it. Please don't do it, because pulse is not always regular. Pulse can be irregular. So you cannot write 15 when you're going to get, you cannot say it is 30. No, never. So you should be very, very careful. Count for one full minute. Count for one full minute, then you write it. Temperature, same. This is a basic. There is nothing to fail in this. But still people fail. I have seen a lot of people failing in assessment. Why? They assume this may be this may be. No, don't assume. Nothing to be assumed, because take patient as a real patient. And if you practice in your real clinical practice without taking the pulse, without taking the respiration, you simply write it in the chart wherever you're working now. That same thing you will do it here, and definitely, believe me, you will fail. So don't do that. Don't do that. Because I tell this, I stress this because of my 15 years of experience in teaching. Being with the students, I have understood what the student do. Don't do that. Don't do that. You do it by your own, you will be rewarded. So that is assessment. A, B, C, D, E. You will be learning that. I will not go in detail about this, but it is very, very simple. Believe me, very, very simple. And it is an active station with the examiner, with the patient, you are doing it. Now, second is P, is a planning. Planning is a silent station. There is examiner is sitting, you are given a paper, you are given a scenario. And this planning is for 12 minutes. What do you do? What you do is, the paper is given when the examiner says, your time starts now. What is given, you make a planning. For example, you get a scenario saying that patient has come to your clinic and with the abdominal pain and bulge in the groin. So he is posted for surgery. He is posted for surgery. Read this. Read this. So you know when the patient goes for surgery, when you talk to the patient, when you talk in assessment, you're going to talk everything. Assessment, you talk everything. Assessment is a base here. Based on assessment, you do the planning, you do implementation, all these things. So when the patient goes for surgery, in your teaching from the NHS, they will tell you, they'll give you all the care plan, what should be written for which case. So when it is for surgery, you know, you need to write safe preparation for surgery, first care plan. And second care plan is sometimes anxiety. Second times maybe he is getting for the surgery. First thing is safe preparation. And second is for the surgery is you are writing him care plan anxiety. Or you will write something else what the patient says. So that you have to keep it in mind and you write it. To write the care plan, you don't worry what to write in planning. There is a structure of writing that is called Emmatari. These are the alphabets which will tell you how to go writing the care plan, which is very easy. Very easy. Emma, E for explain the patient the reason why you're here or what you're doing it. Second, monitor the vital signs. Emma. Again, monitor the pain score. A, assess the pain, assess the surgical site, assess the anything. T, teach the patient deep breathing exercise, teach the patient how to lift the legs, all these things you learn it. R, refer the patient for the pain team, refer the patient for the surgical team, refer the patient for the diabetic team, whatever it is. Instruct the patient, read. I, instruct the patient to use the call bell. And D, document all the care given. It is Emmatari, it is same. If you start writing and practicing, it will come like a water flow. Nothing to break your head on that, but you should know. Now, for example, what happens is, when you receive the patient in the assessment, they said that patient is in the ER who is having bulge in the groin, and you're going to assess him. Now, when you get the planning station, you get the instruction. Patient has finished with the surgery. Patient has finished with the surgery. Write the care plan based on that. Now, what happens is, in a hurry-burry, or I said the failure tips that not reading the instruction properly, what you do? You write safe preparation for surgery, anxiety for this. You fail in planning. Why? Because the instruction says patient has come back from surgery. When the patient come back from the surgery, you're not going to prepare him again for surgery, isn't it? Now the main thing here is he is risk for infection. He is risk for, because he has got a cut wound there, so he is risk for infection. And is in severe pain. You know surgery patients, their criteria, they are in severe pain. So you'll write acute pain, one problem, and you'll write risk for infection is the second problem. In case you're not read the instruction properly and you write say preparation for surgery and patient is anxious during regarding the surgery, you fail. So that is why read the instruction clearly. You pass. Once you finish, you have to put down your name, your initial and date. Very important. That is called documentation. There are people who wrote the care plan very nicely, exactly, perfectly all right, but they did not put the signature of theirs. Fail. Documentation. Documentation. Very, very important. Hope I made it clear. So we got 2 stations. Assessment is over. Planning is over. Now comes the implementation. When it comes implementation, you are doing some act here. What is act? You have a real patient who was there first time in the assessment. He will come and sit here. Now you got a paper with lot of medications, lot. Now these medications, what happens is you have got a timing. Sometimes in the medication chart, it is a tendency or it can be a mistake by the doctor to write the medication. He forgets to write the route. He forgets to write the dose. So thinking that it's okay and you just give it as you want, you fail. So what do you say here? You got the instruction that patient is with the pain, came like this. Now you administer the medication. When you go through all the pages, one page you find it, there is no doctor's signature in the prescription. Doctor has written, give paracetamol 2 tablets every 4th hourly per oral, and there is no signature of the doctor. Do you give it? No, I don't give it. Because in the UK, when you practice, if the prescription is not clear, if the prescription is not valid, if the prescription is not legible, you don't give it. But what you're supposed to do? I said the points that the people fail. Verbalize. Tell the examiner, I'm not happy to give this drug because the prescription is not clear, not legible, and it is not valid. I will ask the doctor to rewrite it. Then I will give it. Finish, you pass. You pass. But if you think, oh, why should I tell? No need tell. You will fail. So that is the thing. Sometimes they'll trick you. They will give you the drug which is supposed to be given before food. And there should be drugs which should be given after food. Okay. Now, for example, prednisolone, levothyroxine. You take levothyroxine. As nurses, we know levothyroxine should be given in empty stomach. So now what happens? In your prescription, the time is put 10 a.m. and 8 o'clock, you had finished the breakfast. Do you give it? That's the question here. So you feel sometime I need to give it. You can tell the examiner. Examiner, is the patient had breakfast long time, 4 hours ago. I think I can give the drug. And you give it. If it is immediate, not even half an hour, you say, examiner, as the patient had a breakfast, I will hold the drug. Communication which is making you pass. Exam is not difficult, believe me. It is only the stress you are in because of the poor practice and getting the ideas from others, which is not very important for you at this time. So that is the implementation. Here also, very, very important, I say, you gave the medication, patient swallowed the medication. Now you need to tell the patient, let me document all that I given to you and write all the pages where you gave the drug, you put your initials. If you don't put the initial, you will get a feedback. You fail in implementation. The reason is failure to document. Finish. Silly reason, you have done a lot of things. With one signature you forgot, you fail. These are very essential. It is not that examiner is partial. It is not that examiners are crazy. Tomorrow, I said already in the beginning of this session, if you don't sign, I will come for the next shift. I will give the medication. You are given, I will also give. We may kill the patient with overdose. It's very, very essential. We say this from the beginning of first year. Document, document, document. Then there is no chance of failing. Is that clear? I think it should be clear to you. Now, last station is the evaluation. What is evaluation? Earlier, evaluation was there. It was a silent station. You write everything from what you did like this. Now, evaluation is our favorite thing, that is handing over to the person using the S-bar technique. S-bar, I think everybody is very clear because Father has made S-bar very, very clear to us. And I think all the all the people, admins, and whoever they are active in EduSkills, they will be the experts to talk about SBAR. So next sessions, if Father gives us the opportunity, we will talk on only SBAR. How do we do the handover? So SBAR, what do? You say situation, that you say you are Shalini Fernandez, registered nurse from the acute health clinic. You are handing over Mr. So-and-so, age this one, to you. And why did he come? What did he do? What happened? What I have to do? Tell everything and you hand over. But one thing you remember in the SBAR, you need to tell the news. What is news? News are nothing but the score that you use for your blood pressure, your heart rate, your temperature, your saturation, your pain, this thing, and your SPO. These things are called news score. Even I say in the assessment, you did everything 15 minutes and they give you one graph. They give you one graph where you need to write blood pressure, temperature, pulse, respiration, and you have to add these points at the end. And you should say whether the patient is in pain or no, whether the patient has to be, like when you get the score, is the patient need to be escalated? Here it is a new term, escalate. Escalate means what? When you are not able to manage, you think that patient is critically ill, you need to tell the doctors, you need to tell the senior manager, yes, this patient score is more than this, he needs something. So that is there in the OSCE exam. You need to tell yes or no. If you don't tell, you fail. And there was at the end, there is a column where you put your initial. You did everything. You said patient need escalation. You told the patient scores. You wrote everything perfectly and your signature is not there. Again, fail. Believe me, there are a lot of people, I feel sometimes very poor and pity for them. They did everything is nice, but they failed to sign in that small page. They failed. And for that, they pay 40,000 from their pocket. 40,000 from the pocket, only you are not able to put the signature. Believe me, such a pathetic condition, isn't it? So you are lucky because we talk about this. So whatever I talk today, don't take it for granted. If you have personal queries, you can mail, you can put WhatsApp message in EduSkills. Anytime, whenever we find the time, we are ready to help you out. Believe me, because we want all of us to pass from the first attempt. That is what is our desire as an EduSkills family member. All right. So this is the thing, what is API station. I think everybody clear? And this API station is for everyone. And you will get a scenario. They have got only 5 scenarios, I think, not big thing. They keep rotating. You may get asthma, she may get pneumonia, she may get subdural hematoma, or I may get maybe surgery, or she may get ectopic pregnancy. Whatever, anyone you may get it. So it is not a big deal. It is easy. If at all you are cleared your GNM, if at all you are cleared your PCBSE, if at all you are cleared your BSc nursing, this API should not be a difficult for you. All right. Now moving to the next station. This is 4 stations. API is a 4. I said we have a total of 10. So 4 over. Now the remaining 4 and 2 more. So what are the remaining 4? Remaining 4 are skills. Now they will see how skillful Shalini is to manage the patient in the UK, because they are scared to give someone in your hand. Okay, because UK always talks about patient safety. They don't want, even I'll tell you, even if there is small pimple in the body of the patient, we need to tell, we have to document. That much importance is given for patient safety. Not only patient safety, as a nurse, the importance given to you. If you're stressed out, if you do not know the things, you can just say, sorry, I am not competent to do this. They will really tell you, no worries, I'll help you. It is not like that our places where, no, why you don't know, you did nursing. No, it's not like this. It is a wonderful place, nursing, what I say, to enjoy, provided you have a good communication skills. So don't worry about this, because you are all are capable, all right? I know you all are capable. If I can reach here, definitely you are much more smarter than me can reach here. So don't worry at all. Don't worry at all. Okay. Now when I talk about next 4 stations, these are clinical skills. So what are the clinical skills? You need to study almost, I think, now they made it 15 skills. They will give you 15 skills to study when you practice. But when you go to the exam, you get only 4 skills to do it. So what are those 15 skills that you practice when you study? First one, administration of inhaled medication. You will get 12 minutes. What you do is, you get a MDI, that is a medicated inhaler, you know, puff, they take it. You are going to teach the patient how to take it, and he will take it with the following all the steps which are given in the checklist. Here also comes, ask the patient name, ask the patient whether he is comfortable, ask the patient is in pain, ask the patient is allergic, confirm his name, then you start. So you pass. After that, because it is inhalation medication, you need to sign. It is a prescription, isn't it? So you need to sign at the end. You did all the procedure, but you failed to sign, you are failed. So that is the thing you have to keep in mind. You have to do it. That is for 12 minutes, you have to finish it up. After 12 minutes, they say stop. Then you cannot say, sorry, I'll sign. No. When you do the skills, you cannot say the examiner, sorry. You cannot rectify saying that, examiner, sorry, next time I will sign. They will not pass. But by chance, if you did not ask whether the patient is in pain, suddenly you remember at the end of the time, before the time is finished, you can say, examiner, I'm very sorry, I forgot to ask the pain. In real scenario, I will ask whether the patient is in pain. So done, you pass. But signature, never. Even if you rectify, signature, no. If you don't sign and somebody give the medication in the ward and patient die and you say, sorry, next time I will not kill the patient, no, it will not work. That common sense, definitely we should have it. Okay. So that is what I want to stress on. Documentation. The second skill is administration of suppository. What is suppository? It is one form of tablet which you put through the rectum. Okay, that is called suppository, and that should be done in 10 minutes. Now, you cannot put the suppository, pull the pant out and put it. Examiner is seeing that. So you need to tell the examiner, let me provide privacy. You should tell the patient, I'm going to pull out your pant. Simply, you cannot do it. India or wherever we practice, patients are so, what do you say? I can say, poor patients, we do as we wanted, isn't it? Which is very bad sometimes because we are having free patients who are lying in the free wards. We can do what we want because they don't complain. No, that will not work here. Everything, even if you want to touch the patient, believe me, even if you want to touch the patient, you need to tell, Mr. Darling, can I touch you? If he says yes, you need to touch. If he says no, sorry, you cannot touch it. So everything, consent is must here. Okay. I remember when I came here, I forgot, one patient was about to fall. So I just hold him. She said, don't hold me. I said, sorry. Because we have a tendency, without asking, we can touch somebody in wherever we practice. That is the eye-opener for me. After that, I kept in mind, never I touch the patient before I could ask them the permission. Never. Even they're about to fall or whatever it is, I would say, you're about to fall. Can I touch you? Can I hold you? It's like that. Understand? Unless they're unconscious, you need to ask the consent. So that is the first issue. Third one is aseptic non-touch technique plus wound assessment, which is 21 minutes. So you get the combination of two sometimes. Sometimes you get separate. You get wound assessment separate. You get the dressing pack separate. So it is 21 minutes. It is a sterile procedure. By chance, during this procedure, if you contaminate the thing, there is no sparing or passing. So if you contaminate, it shows that you are really not aware of sterile field. But in case you forgot to use the third cotton or you forgot to do something, then you can tell the examiner, I'm sorry, in the real scenario, I will use my left hand to pick up the things. Or in a real scenario, I will make sure that I don't drop the cotton on the floor. Okay, those things has to be verbalized because you put the cotton instead of putting in the yellow bin, you put it down on the floor, not purposely, by mistake. And you cannot think, oh, examiner, so no problem, I'll tell tomorrow. No. Immediately you have to tell, sorry, I dropped it down by accidentally in the real scenario. I will not do it. So she will understand you have something in your mind. Understood? That means you can identify what you made mistake. That time they can rely on you. That means you will not do it. They will understand, oh, exam fear, she might have got a little bit scared, she dropped it. So you need to verbalize. Coming to the fourth skill, blood glucose monitoring. You know, we have done so much of blood glucose checking. Nothing to worry about it. It is for 8 minutes. So you will tell the patient, are you allergic to cotton? Are you allergic to this? Did you take food? Because when they say you take a blood glucose, okay, you need to know whether the patient is fasting, whether he had a food, because based on that you will say whether this is a fasting glucose, whether it is a post-fasting, whether it is random. So you need to ask questions. That will be given in your criteria when you study. Next is catheter specimen of urine. Patient has a catheter. Here, in this, inhaled medication, suppository, aseptic technique, blood glucose monitoring. Here you don't have real patients. Here you are doing on the mannequin. Catheter specimen on the mannequin. Mannequin will have a catheter. You need to collect the urine from the catheter to send you for the culture or send you for the routine, whatever it is. And it's a simple procedure, what we have done in our practice. And it is very easy. Next one is fine bore nasogastric tube insertion. You have to put the tube into the nose. Same, here also you need to ask whether patient is allergic, because patient can be allergic to anything. So you need to ask here. Allergy is very important. Then seventh one, that is tube insertion is 12 minutes. Then comes the in-hospital resuscitation, CPR, 6 minutes. CPR, everybody is pakka now, because everywhere CPR has become a very important thing. So it is easy. That was the CPR also in the CPR mannequin. Then comes the intramuscular injection, where it is for 12 minutes. Here you remember, it's a prescription. So you need to see whether patient injection is given, correct routes are given. Right patient, right drug, right route, right dose, right time, signature of the doctor. If it is missing, you should say the examiner, I'm very sorry, the prescription is not clear, not legible, and it is not valid. I'm not happy to give it. So the examiner want to see your skill here. So what she says, does not matter, you proceed. If she said does not matter, you proceed, now she want to see, she knows, you know what to be identified, but she want to see your skill, how you give IM injection. So she will say, proceed. So you have to proceed, you have to do the things, but once you've done it, you need to document it. Don't forget, because I have seen people failing. My cohort only I have seen it, because they did everything nice, because we practice, we are pakka here. But before documenting, 12 minutes over. She did not document it. So don't wait time for washing hand like this or talking too much. No, you document, then you go to the patient, tell the patient, I have given you vitamin injection. You may feel there's some stinge feeling. Don't worry, I am here. I'll be with you. All these things you can talk later. Even if you did not talk all the sentences, you will not fail. But if you did not document, you will fail. So you prioritize what is very important. Because sometimes we just waste time in which is not important. So don't do it. So you have to prioritize what is important. If you have any doubts later, you can ask. Next one is intravenous flush and visual infusion phlebitis. We put cannula in our countries and we just leave it. We don't bother. But here, we need to flush the cannula every time, and we have to see the site for the cannula, whether it is red, whether there is a swelling, whether there is an infection. All these things you have to mark it. There is a marking scale which has to be marked. So it goes beyond, you have to remove the cannula, all this procedure that if I tell you now, time will not be enough. So you will be understanding that later, and that is for 12 minutes. Next is the midstream specimen of urine and urine analysis, which is 8 minutes. What you do here, you will, the patient is mannequin, but you act, you're talking to the patient, because examiner is giving you the answer. Mannequin is sleeping there, but whenever you ask questions, are you allergic? Examiner say no. When you say, do you know how to wash your private part? Examiner say yes. So examiner will answer. So you need to talk. You cannot say mannequin, so simply I'll put catheter. No. You need to talk. You have to think. Every time you think, Even it is a mannequin, you think examiner is sitting. So she is representing the patient here. So you have to talk. So you have to talk here. So that is the thing. Next is nasopharyngeal suctioning. Suctioning, that is 8 minutes. You have to suction the person. Next is oxygen therapy. You have to give oxygen. Same thing here. Oxygen also is a prescription. So you need to sign here. Then there is a peak expiratory flow rate. You know, when you see the lung capacity, we ask the patient to blow. That is called peak flow rate, which is 8 minutes. Then there is removal of urinary catheter. Now, catheter is there in the mannequin, but you need to remove the catheter. So here also, you will ask questions, you will talk, examiner will answer if it is required. So this urinary catheter removal, it is 8 minutes. Then last is subcutaneous injection. This is a prescription. Again, you have to look for the prescription, whether it is valid, it is legible, it is clear. Sometimes doctors' writings are not proper. You don't know whether it is, when we say insulin, it looks something else. You can't read. So you cannot think, oh, subcutaneous insulin. No, you need to verbalize. You have to say, the prescription is not clear. I'm not happy to give it. In the real scenario, also same thing. We don't give it. We don't assume and give the things. Understood? Yesterday, I took the chart to give the patient medication, and I saw doctor had written the doctor has written the drop, eye drop. Okay, doctor has written the eye drop, and he has written his signature, and he has written the route is drop, and he has put the signature. I went to him. I said, doctor, its a prescription is not clear because I do not know which eye to put it. He said, sorry, and he wrote it there. Then I went and gave the medication. If I imagine, no problem, I'll put both eyes. No, you can cause damage. You don't know why that drop is put, isn't it? Otherwise, patient knows, because yesterday the drop is put on left. Today you're putting on right. They can do so many things for you because they are not uneducated. They are educated. They know why the drop is put. They know everything because here everybody is independent. They learn. They care for themselves. It is not that if the husband is sick, wife will take care. No. Here, anything happens to the patient, the place where we work, if the husband is admitted and husband has got a big swelling, we tell the wife, you know, your husband has got a big swelling, you need to go for surgery. But here, if you say this one, not correct. You are legally wrong. You need to tell the patient, you got a swelling, you are going for the surgery. Would you mind me telling to your wife? You have to ask him. He say, yeah, tell. Then he's okay. Otherwise, no. So always it is a patient focused, not the attender. Okay? Attenders are secondary. Patients are primary. So that you have to remember. So these are the 15 stations, 15 skills you will study. But in the 15, you will get only 4. You see how lucky you are. How lucky you are. It is not at 15 you're writing it, isn't it? So it is not difficult. Believe me, it is not difficult. So we finish 4 API stations and 4 clinical skills. So 8 stations are over. Now 2 left, which most of the people say, we hate it, but nothing to hate. It is very nice because those are called, first one is professional values. Professional values. And the second one is evidence-based practice. So you have got professional value. When you study, you need to study 15, but for the exam, you're writing only 1. Evidence-based practice, you're studying 14, but exam, you're writing only 1. So you see here also, you're lucky. Don't think it is 14, 15 and study. No, studying something is nice. You will become more confident and competent. And in the clinical ward, when you work, when you know all these things, you will get more respect and you'll be more proud about yourself. Okay, so what we learn, nothing is waste here. Whatever we learn, it is very, very useful. Take it positively. When you take positively, there is no problem at all. So what are these professional values? Here also, when you practice, your NHS Trust is giving you all ready-made copies. Only what you have to do is, you have to study and you have to keep it in mind what is very, very important. Because you cannot miss out something which is very, very important, because they say red flags. I'll tell you what is red flag later. So the professional values is this. And you see how nice it is, the place where you are working now here. Because you are protected. Your patient is protected, as well as you as a nurse is protected, having these professional values. That means you have to abide by this. You cannot take it for granted. You have to abide. If at all something happens, if you complain, you have to face the consequences. So what are those professional values? First one is bullying. You cannot bully the patient. You cannot bully your colleague. UK citizen cannot bully the Indian. Or Indian cannot bully the Bangladeshian. No, you cannot bully. So what is that bullying? What you have to do? What these things to be done? It is given in the criteria that you have to study. And if you get bullying as the exam, you write that 5 points what is given in the bullying. Second one, concealment of bed status. You see, when India or wherever we work, when there is one empty bed, when the patient discharged, we immediately, there are no people coming and asking whether there are beds are there. Very rare when somebody comes, they ask. But here, if one patient leaves, second patient is filled, because NHS, there are lot of people waiting to come in. Beds are not enough. UK is filled in the hospital, I'll tell you. That's why they want a lot of nurses. And we are lucky we have got enough job here, because patients want to be in the hospital. So because you have to do the admission procedure, you have to do the discharge procedure, let me not tell there is a bed. So we can be quietly sitting. Those things will not help here. So you are supposed to tell if there is, how many beds are there vacant, how many full, those things has to be told to the managers. So those things, as an Indian or as a foreigner, we will not know what is required here. So before you could come to the ward, the OSCE center examination, they will prepare this so that you will be aware when you go to the clinic. Third one, confidentiality. What do you mean by confidentiality? Confidentiality is nothing but when something you find in the husband and husband told you not to tell the wife, you are not supposed to tell it. But you will not keep quiet. You will ask the person, why do you think that you don't want to tell him? You will educate the person. What will happen? Like this, you will talk to them. There is a criteria what has to be taught that you have to study. Fourth is drug error. If there is a drug error, what do we do? What do we do where we practice? When we practice drug error, we'll come and tell the in-charge, oh, I give wrong medication. In-charge will tell you, tell the doctor, finish. If serious, doctor will put the tube, clear everything, or keep ready antidote. But here, when you make a mistake, you tell first to the in-charge, second to the doctor, third to the patient and say, sorry, apologize, sorry. Tell the patient party, okay, apologize, because it should be told. It should be told. Everything should be told. That is called drug error. Fifth one is false representation. There are somebody was saying, I don't know. I come as a nurse with my sister's degree. I am not a nurse, but I come with a sister's degree, which is not supposed to be done. 6, falsification or falsifying the observations. That means you got the temperature, high temperature, but now you know you have to do some procedure. So let me put the decreased temperature. Don't put that what is high temperature, show low temperature. That is the thing is happening. So that will be taught to you. Don't do that. Do what you do, not to put falsifying. What you get, that you have to monitor. Then hospital food. That means you cannot eat hospital food. You cannot carry because you found some sausages in the kitchen. You pack it in your bag and take it home. No, this is not supposed to be done here. That is what. Then coming to impaired performance. The performance, when the performance is not good, what you have to do it. Then laboratory results. This is nothing to worry. When you come, it is a simple thing. You will learn it because it is given. Just you print it in your mind what to write. Some people just try to mug up because Indian education system, we mug up, isn't it? So much mugging up is there. So it is easy for us to mug up and omit later. So they do it and it can be done. Because when I wrote the exam, we had only 5 professional values. Now they increase into 15, which is too much. But still, we cannot tell the NMC don't do it. It is their right and that is their duty. But our duty is to study, not to blame. So we'll study it. Then possible abuse. Sometimes here in the UK, female patients, male patients are looked after by both genders. In India, where I work, I'll mention India, so other country, please don't get anything. So when I say India, males are taken care by female as well as male, and females are taken care by the female nurses. But even if I want to put the catheter, I put it. Even the suppose it has to be put for one lady, young lady, 18-year-old, male nurse will put it. So, but the male nurse cannot abuse the female patient. Female nurse cannot abuse the male patient. That is what they teach us. Then, professional confrontation. What is this professional confrontation? Now, patient party or patient is arguing with you, so you can't argue. Tit for tat cannot be given. So there are steps given what's supposed to be done. So those steps has to be written and that has to be practiced in the clinical. Next is racism, where every people are interested. But believe me, 8 months of my stay in the UK working in the NHS Trust, I did not find any racism towards me. So I don't agree with that, but it will be there. That is why this skill is here, isn't it? So racism is there, but you are lucky and we are luckier, we can speak up. If you feel that the racism is done on you, you can speak up and you will be getting the justice here. So don't worry. Next is 14 is social media. What do you mean by social media? Social media is you are working with the patient and you took the photo of the patient without asking the patient and you put in your, what is our favorite? Facebook. No, you're not supposed to do it. You like that patient and patient is very nice with you and patient, you ask the patient, yes, Shalini, can I put your photo to my family or in my Facebook? Do you have a problem? If she says no problem, then yes. Without asking, because you feel something, you did some dressing and you feel very confident, you want to show your friends in other countries and you take the picture of you doing the dressing on that patient. No, believe me, don't do this. It is a big, big crime. Last one is witnessed abuse. You see somebody, some nurse is doing something to the patient or some nurse is doing something to the nurse and you are seeing it, you cannot just keep quiet and walk away. No, you are supposed to do something. That is called witnessed abuse. So these 15 professional values we have to practice while studying, but for the exam, you will get only one. And that professional values, you have to write it within 10 minutes. And the points are, I think you will have maximum of 7 points to be written. But every professional value, I think almost 4 points are similar. Only 2 points are here and there, but it is not difficult. Believe me, it is not difficult. Then last thing what you get is evidence-based practice. The people who have done BSc nursing, they already know, they do the project in the research project, they know what is this evidence-based practice. But who have done GNM, maybe they may be finding what it is difficult, but it is not difficult because you get a passage about the research and you need to write the answer what is there in the research. But you have a checklist given, you are given the content, you can by heart it, and that same thing you can omit it out, or you can use your brain and write your own words and you will pass it. It is not difficult, believe me. What are these things you'll get? You will get about the ankle sprain. What will happen? The research will say, when the ankle sprain is there, what to do, what not to do. And you need to write around 7 points about that same thing, what you studied, you'll write in the paper. Second one is autism spectrum disorder. Autism. They'll talk about autism in the research. This many percentage, that many percentage, this. It is very simple. Then bedside handover. Then there's a cervical screening. Then there's a cranberry juice and urinary tract infection. That means when you have UTI, whether the cranberry juice is good or no, because somebody has done the research and that points you will be writing it. Dementia and music. When the patient is having dementia, believe me, dementia we read in psychiatry textbook. But dementia is very, very common in the UK and you will feel something, out of place. I also initially in the clinicals when I went, I was thinking, my God, I never seen people becoming so much confused, but I'm seeing here confused. Why? Why? Because you can see, I have patient. Yesterday I saw my patient, 102-year-old man. I was looking after yesterday. Can you imagine his brain will be like you? No. Just now he's telling me, you are my daughter. And within 10 minutes he's telling me, you came to kill me. Go away. You see, this is what dementia, that means they are confused. When? Don't. But you cannot shout at them. You should talk to them like a child. We use all the words, darling, you are in the hospital, my love, and I'm your nurse, I'm not a criminal. You make them understand, soft voice you have to talk, because my voice is always big. So I try to be very soft because it's not becoming soft, but it is harsh when we talk with a loud voice. Okay, they will tell you, you're very rude. But we are not rude with our voice, because that when we use for teaching, we use big voice now to modulate. It takes time. But it's okay. It is a correction for the patient. We have to take it positively. Then coming to diabetes, they will say when you have diabetes, what to be done, what not to be done. Then there's a female myocardial infarction. When the female have myocardial MI, myocardial infarction, what has to be done, what not to be done. It is given. 8 points are there that you have to write it. Then fever in children. Okay, if the child has a fever, what to do? That is there. Pressure ulcer prevention. Because patients are all, majority is elderly, and their skin is very fragile. So there's a tendency to get a skin tear. So you need to prevent it. So what do? That is given. Then the restraint, tying something on the hand for the patient. We cannot tie everybody. So they will tell you when to do it, when not to do it. Then coming saline versus tap water. So they ask about saline and tap water. Then comes the smoking cessation. And the last one is use of honey dressing for venous leg ulcers. These are the 14 evidence practice. Among these 14, you get only one to write it. So don't think it is 14. You think only one. So treat your brain like that with the positive things. It is not 14. It's only one. So lucky you are. Like that you say, and you study, then you can clear. So you had EPI 4 stations, you have skill 4 stations, so 8. Then you have 9 professional values, and 10 is evidence practice. That is a 10 station. Within this, 3 hours are over. And you come home, and within 5 days, you get your results in the mail saying that congratulations, Shalini, you cleared your OSCE. Finish. Now you are independent butterfly, but you are more responsible. You are more determined, and also you are more risk. You are at more risk to face the problem if you are negligent. Your pin can go anytime when you do something which will affect the patient. That's why pin is very important. Once it is gone, it is not good. So we try to preserve our pin. So that is about the stations, what I had to talk about it. Now, I was telling you what are the red flags. See, I told you red flags is the one, because when you get the criteria to study, down it is given red flags. That means you can miss some point, but these red flags, what is given, if you miss it, you fail. So when you practice, focus on that red flags. All right? You have to focus on the red flags so that you don't miss out that. So to give example, contamination of sterile field is a red flag. Okay? And also something that you do which harm the patient is a red flag. You did not ask the allergy, red flag. You did not look at the site. For example, when you give the injection, you did not ask whether the patient had a surgery this hand and you give injection here. Maybe patient had a mastectomy on the right side, and right hand, they have already lymphedema, and you did not ask it, you give the injection, big problem for the patient, isn't it? So you fail. But certain things very simple. For example, you forgot to ask the hospital number of the patient, or you ask the patient maybe to lift the dress. You can ask the examiner, I'm very sorry. In the real scenario, I will not repeat it. Then the examiner will say, no worries. So that is what is red flags is. Now, very interesting is next point, what documents to carry. When you go for the exam, what do we carry in the regular exam, our BSc nursing? We carry the hall ticket, we carry the ID badge, we carry some pens, papers, and other things, isn't it? But what do we carry here? We carry valid passport. Then some people after marriage, their name is changed. Okay, something they changed because maybe I married to a Hindu fellow. I wrote Shalini Krishna Prasad. So my birth certificate is not Krishna Prasad. Birth certificate is Shalini Fernandez. So now I need to take with me affidavit saying that Shalini Fernandez says, change your name as Krishna Prasad. So that's affidavit, or they say marriage certificate. Okay, that name is changed. That can be taken. So NMC will come there. One of the representative from the NMC. She will validate your papers. Then it is easy for them. Then also there's a DBS certificate. If you are there for 3 months in the UK, DBS certificate is like a police certificate in the UK. But if you're not 3 months, you just came, within 1 month you got the exam, you can use your Indian, Kuwait, all these police certificates for the exam. That is what the thing. So I talked about this, and don't think when you are come for the OSCE, never think what happens if I fail. If you think what happens if I fail, more than studying, you think about failure, and always you say, if I fail. So that fail has become so close to your brain, you know, fail. So brain also want to give you satisfaction, and you will fail. So you start your day once you reach UK. Once you reach UK, you start your day. I will pass in OSCE. I will love UK. You know, I'll tell you, I am not boasting about myself or anything else, but what I'm saying is there is a vast difference between people who are positive and there's a vast difference people who are negative. Negative people don't find anything nice in UK. Nothing they find nice. I saw when it was April, May, it was summer here, very nice summer, very bright light, but the light looks very bright, but the heat is not very strong like India. You don't sweat. They started to say, my God, very hot here. I said, yeah, it is a summer. Okay. Then the winter came, it is -1. Oh my God, very cold. I don't like here. You see, you cannot, world or what is environment cannot change as you want it. You need to change as you want to adapt to the situation. But how can we do it? We can do it with a positively. I always say, I'll tell you, when I go out to the duty, because I start my duty at 6 o'clock, I go to the bus stop. You know, it is freezing cold. But what I say? Oh, it's winter, nice cold. But I'll put 3-4 layers because we need to protect ourselves, okay? We need to protect. Wear so many things. My husband is telling, how many things you're wearing? I say, yes, I need to protect myself. I cannot say, winter, you stop. No, but I enjoy. So that is why some of them, they say, in this winter also, how we are happy? I said, definitely, because winter will pass, summer will come. If we keep grumbling on the same thing happens when we are in EduSkills. We talk to a lot of people. Some people, the day one, they are in the EduSkills. Oh my God, it is very tough here. I don't like, you see. Some people will say, my God, it is very interesting. We have a good mentor. We are good admin people. When I saw our mentor, Father Saleen, I take like this, my God, wonderful teacher. You know, I fall in love with him on the first sight when I saw him. With that positive movement, I moved on. That's why even I'm in UK, I said to Father, don't leave me alone. I'm there for you at any time. You tell me anytime, I'll get up and come and join. I'm ready. Why? Because positivity keeps you moving. Learn to be positive. It's difficult, I know, but try to be positive. That is what I would say. You need to move to the positive things. Okay, that is what I wanted to talk about this. Now let me see whether you have any concerns, something, because when I want my thing, it disturbed me. So I just off it. So now I'm going to open it. Any questions by the, just a second. Yes, Father. Yes, Father. Okay. 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 Fine. Okay. Okay. There is a question. Can you help us with a session on pediatric OSCE? Sorry, because I am not a pediatric nurse. I do not know anything about the pediatric OSCE. But I think in the group EduSkills, maybe there will be people, maybe who has already a pediatric nurses, maybe they could help you out, because I don't know anything about pediatric, because from the beginning, pediatric is not a cup of tea for me. So I don't know, but I will try to ask who has passed pediatric OSCE with me if they are there, because with me also they are not there because I'm in medical adult nursing. So I don't give you the guarantee that I can help you out. But maybe if you put it in the EduSkill notification, maybe the people who are already clear, they may be able to help you out. Anything more? Anybody wants to say something? Ask something? Oh, I think my session might have helped you a lot. If not, let us do it later. Finally, to conclude, Father, I thank you so much for giving me this opportunity to be a member of EduSkill, to continue with EduSkill, and also any more sessions to be there. I will be ready to take it, and thank you so much. Thank you so much, all the participants. I can see there are almost 408 participants were there. Hopefully, you had a wonderful time, and I think you might have enjoyed it. If at all you want to have any queries, if you want to know anything, I can give my UK number. If at all you want to take it down, the number is 07-587-328682. And my name is Shalini. So you can have them. And if you have any queries, and if at all I see the messages, and I can just send you the message back. Thank you so much. Have a wonderful day.